So this is a little yoga video chair yoga video for you guys that you can do in between patients, and as you get into private practice, like in between like the doctor check or as you're waiting for your next patient to come. It can literally take anywhere from like 30 seconds to 5 minutes if you want, just depending on what you're focusing on. So the first thing that we're gonna do is kind of come sit to the edge of our chair, and you wanna sit up straight and tall, kind of put your hands in relaxing however you want to be, so like flat or just relax like this. And then we're gonna just breathe for like 30 seconds. And when you're breathing, I want you to be aware that you're kind of trying to breathe more from your stomach than from your lungs, so that you're getting diaphragmatic breathing. And to test that is you can always put your hand on your tummy and then another hand on your heart as you're breathing. So I'm gonna close my eyes and do some breathing, and you wanna do like audible breathing too. So in through your nose, out through your mouth.
Try and get that belly.
After a while, you can put your hands down.
And you might start to notice yourself like sigh, which is releasing some tension and stress. And then just get back to like normal breathing.
After about 30 seconds that you can just relax and get some breathing in, then we'll start to work into some yoga poses. What we're gonna just simply do is just put your hand on your chair and then take your other arm up and just lean over. Just give yourself a good side stretch and lean over this way. You wanna hold each breath or each pose that you do for about 2 to 3 breaths in and out through your nose. So and you can release it, and then we'll do the other side. After we do our side stretches, being at the front edge of our chair, now we're going to just lean forward, and we want to try and lean as far forward as we can, and then just kind of let our arms hang down and kind of be like a rag doll, and just let your body relax and take in those 2 to 3 breaths. And then while you're here, you can shake your head left to right, kind of release some tension in your neck. If you get dizzy, just close your eyes. And then as you come up, just bring up slowly as you're bringing like one vertebrae at a time. Don't bring yourself up too fast or you will for sure get dizzy. And then bring yourself up and come back up to like a seated position so that you're nice and straight and tall. So now we're going to stretch out our chest. So even in your dental chairs, you should be able to grab the back of your operator chair, but here, I'm just gonna be able to grab like my fingers. You should be able to grab yourself through your chair and push your chest forward so that you can stretch out like through the chest. As dental hygienists and even dentists, we struggle with having rounded shoulders. So our shoulders are creeping in forward. We need to stretch out our chest and strengthen our back. So we need to stretch out our chest like this. Do the same thing. You want to try and hold this for 2 to 3 breaths. And you can even lift up your neck like this and kind of give yourself a stretch up through the upper body this way. And even stretch down to stretch through your neck. After 2 to 3 breaths like that, you can release that out. Now we want to do some flexion of our spine. So we're going to do seated cat-cows. And so a cat-cow is where we're going to arch our back like this, like a cat. So you're going to want to have your arms out like this, like a cat, and breathe in and out. Or you can put your hands down like that. And then a cow is going to be arching like this. So arch your back opposite, in, and then out with your breath. And then in with your breath. And then out with your breath. Do this about, 3 to 5 times to kind of give your spine some flexion and release some tension in there. So we're going to do that about 3 to 5 times, and you can kind of go at your own pace of your breath. after you've done some cat-cows, now we're going to do some spinal twists. With your spinal twist, you're going to just hold on to the back of your chair or the back of your seat, and then you're going to just turn. Having some spinal twist is actually really good for your spine and to allow yourself some like stretching through your thoracic spine too. So hold on to the back of your chair. I'm holding on to the back of it right here. You can even put your arm up over the backrest, and you're just going to turn or hold on to your arm or your leg, like this, and then turn. Same thing, you want to hold this for about 2 breaths. So the reason for like the 2 breaths is because like holding it for like 2 to 3 seconds just isn't long enough. And we need to get oxygen to the muscles. And you can shake it out. Now we're going to stretch out our neck. So we're going to start by just saying yes several times, and then shake your head no. And then we're going to do some stretches of our neck. So you're going to take your opposite arm. So my right arm is going to pull my neck towards my right side, and then my left side is either going to hold onto the bottom of the chair or stretch out. And then I'm going to kind of just give myself a gentle little pull, and my left arm is kind of pulling in the opposite direction, so that I'm getting a nice stretch here through my neck and through my upper trap right there. Same thing, hold that for a couple breaths. You might feel like quite a bit of tension through here, and then just slowly relax your arm and release from your neck. And then we're going to do the opposite side. Pull my left arm up and over, and then let this arm stretch. And then you'll get a nice stretch here through your neck and through your traps. Okay. The next one, or another one that you can do with this, is called eagle arms. And with eagle arms, you're just going to put your arm straight out. You're going to cross at the elbow, and then you're going to twist. Pay attention to what arm has like your pinky outside, because you're going to switch arms. So with them twisted like this, then you're going to slowly and gently just push your arms up. If your hands can't touch like mine can, they can be apart like this, and then just pull upwards. So you're going to pull upwards, and it's going to give you a nice stretch across like your traps and your upper back. Same thing, hold this for a couple breaths, and then relax and release, kind of shake it out. And then you're going to cross it so that the other arm is going in front. So now I have this pinky in front. So same thing, lift up, and you can even kind of like bend your neck if you need to, or even like round your back even a little bit more, kind of going into that cat C shape, and you get a little bit more of a stretch. But then remember to breathe and relax it down. Okay. Those are my upper body stretches. Because we sit for so long too, we'll get really tight hips. So something that you want to do while you're waiting for the doctor is doing what's called a figure 4. So while you're sitting here, you're going to put your opposite ankle across your opposite knee, and make sure that you're flexing your toes so that they're like spread out. By flexing your toes, you're going to help to protect the safety of your knee. And then you want to just lean forward. And I bet you everyone has really, really tight hips. So you're gonna lean forward, and it's gonna feel really tight and hopefully not painful, but you're gonna lean forward as far forward as you can. That's not gonna cause discomfort. But lean forward. If you need a deeper stretch, you can like reach through to the floor like this, or just lean forward, same thing. Kind of push your knee down, but not with a lot of force. Just help to push your knee down like this. And then give this a couple breaths. Okay. And then switch. Another seated exercise to do just to help our hips and even our lower back is to stretch your hip flexors. So while you're sitting here, just extend your one leg out forward, and then do the same thing, like lean forward over it. You'll feel it through your calf, and you should feel this all the way up through like your hamstring here. Your lower back is this muscle here is actually connected to your hip flexors. So we want to try and loosen all of this up and like stretch it out. So stretching out your hamstrings, stretching out your piriformis, which is what we did with that figure 4, is a way that you can help to relax your lower back if you're struggling with lower back pain. So just remember, whenever we're doing holding a pose or holding a stretch, you want to hold it for 2 to 3 breaths as you're doing this. So in leaning forward as far as you can go, you don't have to touch your toes like I can, even if you're just touching your shin or your ankle. So just go as far as you can that is comfortable for you. And then you can come in and relax it down. So those are some good chair yoga moves that you can do while you're waiting or in between your patients. And then I'm going to show you some other exercises that you can do on the floor and even using like the walls of your room. So I wanted to show you some other exercises you could do even while like you're on your lunch break, or if you were at home and you needed to stretch out. I stretch out almost every night before I go to bed. And if I have time, I stretch out in the morning. Instead of doing a seated cat-cow, one of the best things you can do is like an on-the-floor cat-cow. So an on-the-floor cat-cow is just where you're going to be on your hands and knees. So you just want to spread out your fingers so that you have equal distribution of weight amongst your hands. And if like being on your wrists hurt, you can also be on your knuckles like this so that you can keep your wrists straight. Then you want to just try and keep your hips over your knees and your shoulders over your wrists. So I like to do this with my eyes closed, but you're just going to follow your breath with this and just do a breath in and then a breath out, and then we'll go into our cat-cow. So we're going to go. Do this about 5 or 6 times, like just as I feel good. And you can, once again, kind of like shift your hips around if you need to, or shake your head around if you want. But I sit there and do this cat-cow about 5 or 6 times as I give my back some flexion. Next thing I'm going to show you is, it's called extended child's pose. So child's pose is just going down like this and extending out. But extended child's pose is that you're going to extend your knees out just a little bit so you're a little wider. And then you're going to extend out like this. And that's going to give you a real good stretch through your mid-belly. You're going to extend out just like this and try and pull your arms and push your arms as far forward as you can while you're kind of pulling yourself backwards. And that you'll get a really good stretch across your upper back. And just hold that for a couple of breaths. And you can even like shake your head yes or no. And kind of relax your neck through here. Not yes or no, just no. Shake your head no and do that. From this position here, we're gonna do what's called thread the needle. And so you're gonna hold your position like this with your legs extended out if you want, or you can bring your knees back in. But what you're gonna do is kind of give yourself a nice little stretch, open like this, and hold your arm up in the air. If you can't reach up like this, you can even just let your arm dingle down, but you wanna give yourself some rotation in your spine, up like this. And then we're going to thread our arm through the needle or through the other arm this way. And sorry, I'm not facing the camera, but you're going to want to try and push your shoulder into the mat. And what that's going to do is give you a nice shoulder stretch here. An alternate that you could do is just going as far as you can and then just pressing your shoulder or your arm into the ground, and that'll give you a nice shoulder stretch across here. Like an alternate that you could do is just pulling your arm this way, but you're using the floor to help give you tension or resistance. And then we'll do the opposite side here. So I would put my arm up like this, give myself a rotation, hold this for a couple breaths, and then I'm gonna thread the needle this way and try and push resistance against my arm here. Like I said, you don't have to copy me, but I like to do this thread the needle. As I mentioned, you really want to try and stretch out like through your lower body too, not just your upper body. So I like to do what's called low lunge or low lizard, and I'll use my yoga block for this, but you're gonna put your knee forward here like this. You want knee over ankle, and then I'm gonna use my yoga block to put my hand on, or I'll put like my wrist like this. And then I'm just gonna push forward so it stretches here through your hip flexor. Remember, your lower back is connected. This muscle here is all connected through this hip flexor. So you wanna stretch this hip flexor to help relieve any tightness or tension in your lower back. So you can just keep your foot down on the ground, push forward like this. If you wanna do something more advanced, you could lift your leg up like that, and you're pushing opposite this way, and I'm pulling opposite this way. So I've got tension going in both directions to pull on this hip flexor right here, and also helps to stretch through like your piriformis. Then I'll even pull backwards like this, and this will give you another stretch here through your hamstring. So you'll hold that for a couple of breaths too, and that's a good way to stretch the lower body. So knee over ankle, push your body back. You might even have to scoot your leg forward to give yourself a stretch, and then stretch here. So you're getting that stretch through your hip flexor. Your hip flexors will get really tight just from sitting all day. We sit for close to 8 hours, or if you're not standing too, doing hygiene, which Ann Pattison said you should be trying to stand doing hygiene too, not always just sitting. So kind of keep that in mind. I like to alternate with my patients. If I just took bite wing x-rays on them and I have the chair up higher, I'm gonna stand doing my cleaning. Or if I didn't do it, then I'll sit. So I try and alternate through my day. This is one other chest stretch that you can do, and it's called a reverse bridge. And so you're going to just put your heels flat on the ground, and you're gonna put your hands at 3 o'clock and 9 o'clock, or 3 and 9, and you're going to kind of push your bum up in the air, but rather than push your bum up there, I want you to push your chest up like this, so that you should feel like a nice stretch across on the front of you. So let me turn sideways so you can see here. So 3 and 9, really turn yourself out like this, plant your feet or your heels, and then rather than push your butt up like that, try and push your chest forward like this. And you're gonna hold that for a couple breaths, or at least 30 seconds if you can. And then relax, and you can shake out your wrists and stuff, but you should feel a broadening across your chest through your collarbone and your clavicle. Other things that we want to do is to stretch this out. This is from Brian Wilkinson doing the Core 4, is to kind of imagine that you're standing in the doorway. So you're gonna want to put your arms straight up like this, bring them out to the side like you're creating a box. And when you bring yourself out to the side, you're gonna kind of pinch your shoulder blades back. So you're gonna be pushing your chest forward and pinching your shoulder blades back like this. And then you're gonna do this about 15 times. And then you're just gonna be sitting here tracing like a box. So forward, it's up, out, and then back in, and then 15 times doing this. And then as I'm coming out like this, I'm trying to press my shoulders forward, and I'm going to be pinching my back here so that we get like a nice stretch out through here. Other ways to be able to do that same kind of stretch without having to do this motion is if you went to a door frame and you pushed yourself away from the door. So I'm getting a nice solid stretch right through here. I'm putting my hand here, and then I'm pushing myself away so that I have a stretch through my pecs. Because remember, as hygienists, we're gonna have rounded shoulders, so we need to release this muscle by opening up into our chest. So here I'm gonna hold the door frame, and I'm gonna kind of turn away from it, so I get this nice stretch right through here, through my pec and upper deltoid right through here. So you can do that box movement, you can do that bridge movement, and you can even hold into the doorway to help to release this. Another exercise is to help kind of give some relaxation and some stretch through our hands because of grasp is you're going to put your hands into like a prayer mode right here at about your heart, and you're just going to give yourself a nice push here, and that'll give you a stretch through your palm and through your wrist right here. So you can give yourself a good like stretch with pushing just right through here. You want to hold that for about 30 seconds. And an advanced or progression move like this is to still do the same thing, but then just move it so that you're pointing your hands downward. So your prayer hands are going down like this. And you're pushing into each other so that you should get a stretch through your palm, through your wrist, and even through your forearm. And as you do that, remember, you want to hold that stretch for about 30 seconds. Another stretch to help with your grasp is just to put your hand out forward like this. So forward, it doesn't matter if it's higher or lower, just put it out forward. And you're gonna grab your opposite hand and grab across the knuckles right here, and you're just gonna pull. So pull your hands forward. Don't let your fingers collapse like that, because that's gonna stretch through your forearm. Although you can do that, but you wanna just stretch through your palm for your grasp like this. And then more advanced would be to actually turn your thumb inward, so like this. So a progression move would be to turn your palm so that your thumb is down and your fingers are going in the opposite direction. Give yourself that same stretch through here and through your arms and to the back of your hand like that. The last one, which if those other hamstring positions are harder for you, you can lay on the ground. Hopefully you can still see me. And then you can get a belt, a towel, anything like that. And you just put it over the top of your foot. Keep this foot bent, and then just try and pull this straight. Like your legs might be more out like this, and that's okay. Or you'll just try and pull it towards you like that if laying or sitting and kind of bending over your body is hard. And then just kind of try and pull this forward. Don't pull it to hurting, just pull it till you feel a good stretch, and then hold that for a couple of breaths, which is like about, I don't know, 10 seconds or so. So I wanted to share with you some tools that I have used to help me with my back pain over the years as a practicing dental hygienist. So the first one, and I just started using it and I love it, this is called an acupressure mat. It has little spikes on it. So you lay down on it initially with like a sports bra and maybe a thin t-shirt, and then you work up to laying down on this bare skin. And what it's going to do is it's going to cause more blood supply to get to like the muscles in your back and stuff. And it releases and helps release anxiety and tension through your back. Not going to lie, it initially hurts, but then after a while, it's like very, very therapeutic and almost euphoric for how good it feels. So this is one thing that I use. You can buy them on Amazon for like $30 to $80 depending on how much you want to spend. Mine comes with a pillow too. If you haven't already purchased one of these, I highly recommend buying a TENS unit. So TENS units just help to shock the muscle, relax the muscles, also helps reduce pain rather than having to take ibuprofen or something like, or Tylenol. If you have muscle pain, you should be taking ibuprofen versus Tylenol. So a TENS unit is what I highly recommend. This is a Healthmate Forever. It's very generic, but it's my favorite. I love it. Another thing is a lacrosse ball. So a lacrosse ball I love because I'll even drive with it in my car, and I'll put it right like on a knot, and I'll sit there and roll back and forth on it. Or you can even lay on the hard ground, or like your carpet and stuff, and just press against like a knot, and to help release that with just some pressure. You need something stronger than like a tennis ball. So a lacrosse ball works really, really good. You can also use it, this isn't going to be the best, but like up against a wall like this, and hold it into a spot to be able to work out a knot.